Hello and good afternoon. I am Ben Marcantonio. I'm the Chief Operating Officer for NHPCO, and I'm delighted to welcome you all today to this very special town hall, which we will focus on strengthening your workforce through the power of dialogue. The new NHPCO Listening Sessions Toolkit will also be a part of this. This all is part of a series of conversations with members delivering care at the bedside, as well as all of you as leaders in administrative roles, aimed at addressing today's significant workforce issues. Last fall at the Interdisciplinary Conference, we held a listening session, and then following that, a few weeks later, an executive dialogue, all focused on workforce. Based on those conversations, we've created a listening session toolkit that we hope you will use at your own organizations in going forward. Today, we want to provide a venue in which we can share, because there's a peer group here that we can learn from and support each other through, and understanding what we all have gone through in these last couple of years and that shared experience. We also want it to be an opportunity to advance other opportunities for you to be part of the solution, in all of us being part of the solution in responding to our workforce issues. And then finally, we hope that today we'll accomplish an experience of community, of not being alone in this. Just a few logistical issues before we begin I want to cover. First, I want to remind you that if you haven't already, to please download the mobile app for the conference, because that is where you will find the sessions evaluations, presentations, and you'll also find the listening session toolkit there as well in the mobile app. As a reminder, this session is not accredited, so continuing educations won't be awarded for this particular session. And then last but not least, please just a reminder to take a moment to check your mobile devices and make sure those are silenced. And now I would like to introduce our faculty. Laura Adams will be facilitating this town hall and is no stranger at all to NHPCO. She actually facilitated the listening sessions that we did at the Interdisciplinary Conference and also at the Executive Dialogue last fall. And we're so happy to be working with you, Laura. Laura is the special advisor at the National Academy of Medicine, where she provides leadership for the digital and evidence mobilization portfolios of the Leadership Consortium. Her expertise is in digital health, healthcare innovation, and human-centered care. Previously, Laura was the founding president and CEO of the Rhode Island Quality Institute, Rhode Island's statewide health information exchange. Today, she will be talking with Brian Jones, CEO and president of Share Foundation, and Susan Lloyd, the president and CEO of Delaware Hospice Incorporated. I hope that after this conversation takes place, we'll have the opportunity to share experiences and ask questions. So welcome, and I'll turn it over to you, Laura.
Thank you so much. I couldn't be more pleased and excited and delighted to be here. I think that NHPCO and everyone did their best to make it through what's been a really surreal couple of years. And we did our best to do everything we could virtually because we had to. But there is just nothing like coming back here and being in person. This is my first in-person session this weekend, and today coming back into the real world of interaction with people, and there's just nothing like it. So when I say I'm pleased to be here, I mean it more deeply than I think I ever have when I've been on stage to say that. So working with Brian and Susan on this has been an absolute joy. Mary Kay Sheehan also worked on this with us. Mary Kay couldn't be with us today, but she sent in her insights to be able to share with you today. And as Ben mentioned, we did this at the Interdisciplinary Conference last fall. And we were just thinking we were going to be able to engage people. We were going to build a sense of connectedness and community. We were going to be able to gather up some ideas, some creative solutions, co-creation of those solutions. And then as we were doing the planning of it, and as time came closer and closer to actually doing the session, and then when the session was so vibrant, and people they were interacting, and if there wasn't someone speaking, of course it was virtual, the chat was going like wildfire, back and forth, ideas, questions, people connecting with each other. And we started to watch that magic unfold. Even virtually, we watched it unfold. So I got to thinking, I design and deliver these things all the time, but I did them as one-offs. Just, sure, I'll do one for your organization and do one for your organization. And we got to thinking, what if we put this power in your hands? What if we took this, downloaded everything that we had learned and that I had known from my experience about how to do these, and put them in a toolkit for you? Would that work? We didn't know. So we thought what we'd like to do is design this toolkit and then invite some innovators, some fearless people who already felt their inner rock star, apparently, because when we issued the invitation for them to be the first intrepid users of the toolkit, and I was a little bit concerned, Omicron, peaking, everybody's exhausted, the tsunami of issues that confront you every single day. I actually felt a little bit guilty about saying, hey, you want to pilot a toolkit in the middle of all of this? But I also felt like, and I know that Carrie Hoover and Ben and I all felt like this was part of the solution. It wasn't another add-on. And so we asked these innovators if they would be first to put footprints in the snow on this. Actually, I should have used a spring metaphor because it's 80 degrees outside. So if they would put their toe in the water first. And they agreed, much to our delight. So what we want to share with you today is a little bit about that toolkit. It's free for your use. NHPCO has put this in your app, and you can access it as one of the handouts and materials. And we hope you will use it because we think we have a story to tell about it today. And I'm so delighted that the idea was conceived to build this out, to put everything we know down on paper, including things like sample scripts and ground rules and how you run the thing and create success with it, to put it in your hands. So that's what we're going to be talking about today. And so let me just, I think I need to go back to, yeah, there we go. So you've got all of our names there. And again, I want to acknowledge Mary Kay, who couldn't be with us today, but has contributed her wisdom to this as well. So I want to be sure that you know the purpose and benefit when we get done of conducting learning sessions in general, if not using the toolkit. But just what do you gain out of these? And secondly, to describe the key elements of this toolkit that we will put that power in your hands. And I'm now convinced after watching these 3 pilots, and I know we've got 3 data points, but they were 3 extraordinarily well done data points. And we have growing confidence that this is something that you can take home and put to immediate use. So, click, there we go. All right, so the purpose of this, I think we originally started out as to be a bit of infusing humanity into what we were doing. I think we were all coming exhausted, afraid of the future, worn to a nub in the middle of this last fall. Not that we aren't still feeling quite a bit that way right now, but at least we're back together. But back then we were still virtual, a feeling of isolation, and a sense of just an overwhelming magnitude of problems facing people. So the purpose of this toolkit was to begin to make sure that we were building in human connection into the interactions with staff. And the other thing that is just the magic and miracle of these sort of listening sessions is that you really can work with the staff to co-create solutions. I'm thinking about one of the things that you'll see that Mary Kay contributed, and she said, the staff know the answers, and I keep forgetting that. I keep not remembering about the fact that they're immersed in this. They have these fantastic ideas. It took me back to a time when I was running hospitals, and I used to see this person in dietary that I always passed by, Mary in dietary, and I would see Mary in the hallways, and she'd be delivering trays, and Mary wore a hairnet, and Mary was always just doing her job. And one day, I just happened to sit down with her at lunch, and I said, so what's up, Mary? And she said, I'm going on vacation. And I thought, well, fantastic. What's she gonna do? I don't know, garden or do a few things like that. I said, what do you plan to do with your time? She said, I'm gonna visit Hemingway's birthplace because I've read all of his books. Have you read any of his books, Laura? Hemingway, Muriel Hemingway, she's the one that got the, no wait, that's a different one. No, I really haven't read any of his books. I was flabbergasted, floored. And it was an my first insight that the people that we work with every day leave our environs, leave our facilities, leave our organizations, and go home and go out and they run Boy Scout troops, and they run things at church, and they do amazing things in the community, and they are this whole person. And all I could see was Mary who delivered trays. And it was one of the first time I ever got this insight into, if you would take just a few minutes to really get to know people and really create conditions in which their power and their abilities would emerge, I think it would astound you. And so I began trying it, and it did astound me. So the purpose of this is not just to give a chance for the staff to be seen, heard, and for them to be able to express themselves about what's going on currently, although talk about power in that, there is some. It is really to think about a powerful tool to confront some of these challenges, because some of the ideas that the staff can generate are ideas that we could never create on our own. We've really begun to invest in that idea that all of us are better than any one of us. And this is one of the examples of where that comes true. So the listening session goals. This toolkit was created and designed so that the closest people that are closest to the work can feel that they have been seen, heard, and understood, as we said before. To know that they're not alone. That's one of the other things we wanted them to understand, whether it was virtual or whether you did these things in person, that sense of connectedness, that sense of belonging, that sense of being. We wanted them to feel that connection, both around work issues and to each other as human beings. And then to understand that they have power. They really have power, and they are part of the solution. So many times I think we care so much about our staff, so much about our organizations, that we feel it's our job to try to think up all the solutions, ours and the senior leadership team or the management team, and we think it's incumbent upon ourselves to come up with all of those answers when they're ripe for the picking there, if we can just create the conditions for them to emerge. So the listening session overview, I want to give you just a little bit of an example of what's in there. These are gatherings. They're about an hour long. We recommend that they be facilitated. We've written them as a dialogue, but essentially this is a singular opportunity for you to listen, and to listen to the extent that you can in an uninterrupted fashion. And we'll come back to that several times about that notion of being uninterrupted. We want a recognized organizational leader. It doesn't have to be the CEO, but it can be. But a recognized organizational leader and a trusted individual. We want that person first and foremost to be the one that people will feel comfortable opening up to. When they can be done in person, virtually. We've designed the guide so that there's instructions for both of those types, because we know we're not out of this situation yet. But we really want the goal of this to be to create a feeling of them where they know deep down that this is a safe space, that they have this capacity and ability and invitation, not just the ability, it's an invitation to be authentic, to be genuine, and to be able to feel like they can talk about things without repercussion, without something coming back on them. We want to design to assure that the dialogue doesn't turn into an overly negative session. I know that could be someone's first concern, is that, oh boy, you don't know how mad my staff is, or you don't know how burnout they are, you don't know, and I think this feels a little bit risky. Well, we've designed this very much so that there's a container in which this happens, so that this doesn't end up being a situation in which that those sorts of things arise out of it, and there's no control over that, and there's no conditions creating another culture to come into this. So we know too that we want these to be the best chance to succeed when they're part of a larger organizational strategy. They're not too effective as just a one-off. But my guess is that most of you have other organizational things going on. You don't have just nothing in the way of engaging and working with your staff through issues or trying to address workforce challenges. You got other things going on. This would be good to strategically tie this in. We don't want it to be a one and done standalone, and we certainly don't want this to be, we did it, dust off our hands, and then they never hear of anything again that came out of it. What they want to hear is follow-up. What they want to hear is a continued dialogue, and we suspect from what Brian and Susan will share with you today, and I'll share with Mary Kay's slides, is that there's a sense that you may want that follow-up too, that you may want more of these. It is not a one and done. So And thinking about going forward with this, here's some content inside that. So we go over the purpose of it, the goals in there. There is the information on sort of the key components of this, how you set all these things up. So you can see from that insight in there, we've got samples of ground rules. We've got, hey, what does a good facilitator look like? What's the profile of a potentially effective facilitator? What should the organizational leader profile look like? What's the role of the organizational leader in all of this? What is their job when they come into this? What do we expect for them to do in order to create those conditions for safe evolution and blossoming of conversation? So we go all the way through to where we have written, again, sample ground rules. There's sample questions. You could actually implement this verbatim, and you wouldn't even need to customize it. We tried to do it that completely, but feel free. You know your organization, and we don't. So you may want to twist. There's a couple of things that we'll share with you today that I know my colleagues are going to say, don't mess with this one. Because this component really matters. So we'll have a few of those topics and stories for you today. And we've also got a sample script in there, stem to stern, top to bottom, with time. Carrie Hoover, thank you so much, because she broke out beautiful scripts for us to use when we did this last fall. We've provided all of that for you. We've provided what should you do in the event that, what should you do when you get finished with these things? What are the lessons learned from that? So there's the content. I think now I'd really love for you to hear from our innovators, the ones that put the toe in the water and the footprints in the snow, depending on where you're from, and listen to the richness of their first test of change, as we say. Those of you that are deeply engaged in quality improvement know exactly what I mean when I say that we did a PDSA cycle on this. We planned it, we did it, we studied it, and we acted on. We did some changes to the guide, their input. We had to do a couple of major changes to the toolkit that I will be grateful for them for strengthening and creating that toolkit to be a much more usable, valuable toolkit. So I'm going to sit back for a minute and really enjoy your time and listen to Brian share his experiences with his first pass through with the toolkit.
Well, thank you very much. I appreciate that. I'll be the first one to tell you that when I was asked to do this, I don't know why I was asked to do it, but I was a little skeptical of the whole idea, because I'm not really a kumbaya kind of guy, and I felt like getting in a room with a bunch of people in a circle and doing all that kind of stuff was a little bit, outside of my wheelhouse. And I also felt like as an organization, my office door is always open. People can come anytime and talk to me, and my goodness, every month I do bagels with Brian, and so people can come. I go to our different sites. We have kind of a complex organization. We have a lot of different things that we do other than hospice, and so I go to the different sites, and we sit down and we have coffee, and actually in South Arkansas we have spud nuts, and I can talk to you later about what a spud nut is. It's not really a bagel. But, and we've been voted in Arkansas, where I work at, the last couple years, one of the 50 best places to work in the state. So I'm thinking, we're already pretty good at this. And so, but I'm an NHPCO team player, and I'm going to help out in any way that I can. So basically, our hospice director, I asked her to select some individuals, an interdisciplinary group, and I think there was about 6 or 7 altogether. And we met we met in the chapel in our hospice house. And we met in a circle. She was the one who, our hospice director, kept notes, and I facilitated the discussion. And I didn't mention this when we had our preliminary discussion on this, but I actually made 3-by-5 cards so I could kind of follow them and to make sure I kind of stayed on task as I went through this. And so I'm like, okay, the first question really dealt with things like, how difficult is it right now to work in healthcare? We knew we wanted to talk about that. And we also knew that we wanted to talk about on-call. We kind of identified that was an issue that maybe we just needed to, kind of the elephant in the room that we needed to bring up. And so I'm here to tell you this was just an amazing experience at how open, it was quiet at first, but how open everybody became. And we laid some very clear ground rules that are in the toolkit. We made sure that even though Jennifer was taking notes, we wouldn't attach any thoughts to any individuals. It was more thematic. And so we stayed with that, and we promised them we would listen to them, and this wouldn't be, as was mentioned, a one and done, that we would follow up. And so when we talked about healthcare and what's going on, it really amazed me. The staff talked about how COVID had a big impact on their lives, how they were afraid of catching COVID, how they were afraid, some of them mentioned they had small children, they were afraid of bringing COVID home to their kids or to their spouse, and just the struggles associated with all of that. The hardest part for me was when the staff starts talking about all these things that are wrong and things that are kind of weighing upon them and some of their solutions. The hardest part for me was to just sit there and be quiet and not try to say, well, because obviously I have inside knowledge about things, and I know why we don't do certain things, and I know financial reasons maybe why we don't do certain things. And I wanted to enunciate that, and I wanted to articulate that and say, well, there's a reason why we don't do that, but I kept my mouth shut, which was the hardest thing to do. And a lot of us who are in the roles that we're in, we like to talk, and we like to be out front, we're kind of good at it. And but it was all about really reining it in. And I asked our hospice director, I told her, I said, give me the stink eye if I start to, say too much. And so I'm really kind of proud of myself, to be honest, because I really, really did listen to our staff, and they had so much to say. And they were very open. The nurses were very open. And it was really interesting because of my position, and probably like your position, I could effect change as a result of these conversations. So a couple of things that kind of came out that we were able to score some pretty big wins with very quickly was the fact that a lot of people had burned through their sick time because either through isolation or quarantine. And at first, and again, this is me, and I'm just going to be honest with you, I'm kind of tight, right? And so I'm like, we have a very generous PTO plan. We have a sick leave and a PTO plan. I mean, we have two different banks here, and they're great, and people accrue them pretty quickly. But they told me about there was a hospital in town that had done something special with sick time, and so, I'm listening, and, I'm just listening to what they're having to say. And so there was also some comments. We have a nurse. This is kind of interesting, too. We have a nurse who had been at the hospital for 13 years. She came to be with us. Almost immediately, she comes to us, and she's pregnant. And so all of a sudden, she's not eligible for FMLA, because of her short time with us. So, and then on-call discussions came up. So as a result of all of this, some big changes happened in our organization. I went back to my leadership team, and I said, we had this listening session. I want to tell you about it. I need your input. I think there's some things we can do. So we immediately gave everybody in the organization who was benefits eligible, we gave them an additional 3 days of sick time in their banks. And that just went over like crazy. Everybody was just really excited about that. I got lots of emails from that group because they felt like they were heard in what they said. The other thing is that we're trying to enact right now is a non-FMLA policy. So for people in our organization who are not yet eligible for FMLA, or for people who have exhausted their FMLA, and there's a really weird story. We had a nurse practitioner who actually ended up leaving us and dying just a couple days. But she worked to the very, very end. She had cancer, and she had exhausted her FMLA. And if she had, this is awful to say, but if she had not died as quickly as she would have died, she would have had to go on COBRA for her health insurance if we didn't have a non-FMLA policy. So that's something we're starting. And then we realized our on-call pay, my goodness, we hadn't changed it in years. It had stayed the same. And so we had to do some budget crunching because obviously the budget's already been set for 2022. But we had to do some budget crunching to see if we could come up with some additional dollars to pay our nursing staff for their on-call. And so we're in the process of making that happen. And, I have other parts of the organization, like, because I'm a foundation, operating foundation, in addition to our hospice, we have a clinic. We also have a fitness and aquatic center. And if you've ever ran a fitness and aquatic center, it's like junior high. I mean, it's like crazy. I mean, everybody's like wearing spandex, and it's just an interesting, you got hospice over here, and you got spandex over here. and it's just a really interesting setup. But they have their own issues, right? I mean, they don't have on-call issues, but they have issues as well. And so, I really feel like there's an opportunity to replicate this listening tool with that group as well, and hear their concerns, which I know will be very different than the concerns that I heard with our hospice program. But, the session we stayed on task. It lasted an hour. We listened intently to what the staff had to say. It was a little quiet at first, but people really opened up, and we assured them that this was not an empty time, that we were really listening. And I also told them, too, I can't promise anything, as a result of this, other than I'm listening to you, and we'll see what we can do. And, it's easy sometimes to score these wins with staff. And all these bagels with Brian, which I think are just awesome, right? Or spud nuts with Brian, just didn't give us this kind of information. And when we do our employee survey, which, had allowed us to win this award in the state of Arkansas, nobody put in there, those kinds of narrative comments. So, people were very open. And I did ask our hospice director to choose, not necessarily, I wanted people who represented a good cross-section of our organization. So we had some tenured people, some newer people. We had some race and gender diversity as well. So we had a good, group of people who kind of represented, I felt like, our organization on many different levels. So, but they were people who had reputations that they were, willing to listen. And I think Susan's going to talk about this too. It's often good to pilot with a group of people who, will generally be people who will give good feedback, and this certainly was the case. So I can't stress enough, again, as I mentioned earlier, I'm not a kumbaya kind of guy. I thought, are we going to light candles and, meditate and hold hands and do all that kind of stuff that I'm just not into. I know social worker stuff. I'm just not into all that kind of stuff. But it was really good, and it's something that we need to, probably periodically do from time to time in our organization.
Brian, thank you so much. I love hearing the actual experience. And he was point blank when we got on to do the prep session for this. He said, the first thing he said was, I don't know why you picked me, because I just am not the warm, fuzzy. This was not, I'm thinking, what in the world? But thank you so much for being willing to be an innovator and trying it out. And now, Susan, let's hear your experiences.
Well, I too was asked to do this, and I thought, sure, I can get this done. No problem. I'd like to participate and help. And then I hung up the phone and I thought, what have I just gotten myself into? Because at Delaware Hospice, we weren't only dealing with COVID-19. We decided to change our EMR this year. My staff is not very happy with me right now. Not at all. We also have been talking quite a bit about engagement and communication and trying to keep people moving during this period of time, and how we could better do a lot of things in this COVID world, and a world that was changing quicker than we could keep up with. So long story short, I did move ahead, and my HR director and I set up a session. I asked HR to pick the people. We have multi-sites at our organization, so I chose one site. A group of 7 to 8 individuals that were across the board with disciplines and actually some of the service lines that we provide. We did go over the ground rules. We had to do this on Zoom, which was unfortunate, but we have still up our way. We still have a lot of restrictions in place, particularly in healthcare, with some of the numbers still high in some settings. So we did a Zoom call, and we set the stage for them and said we were not going to record this. That wasn't the purpose. We would have questions that we actually sent out a couple questions. I'm not sure that I said that before either, but when we stage set with the invitation, we did send them a couple questions just to get them thinking, and for them to realize that this wasn't something that was going to be pointed at one particular issue, but we too did the how is it in healthcare question. We asked about what are the things we should keep doing or stop doing or do more of, and a little slow to get started, but it became very evident right from the get-go that my staff was really struggling. And they were struggling around the issues of burnout. They were struggling around the issues of isolation. Stories told to me around just even getting together for team and not being able to be in the same room or have a potluck lunch together that they often did as part of their routine before COVID. Just how desperate they were to get back in person again and how much they missed their colleagues. But also expressing, which I thought was very interesting, that they weren't upset with the organization, they were upset with what was going on. But they wanted me to know that there were a few things in the organization that I needed to pay attention to. And just as we talked about before, it was hard to keep my mouth shut when some of the things came out. It was definitely hard to keep my mouth shut. But you understand when you have these sessions that there are things that are going on that you as CEO may not have any knowledge of, have no clue about. And you think you're providing all the resources and supports that you possibly can, and then you really get in there and start to listen and you realize, maybe not so much. So a couple things came out of these sessions, which unfortunately I haven't been able to fix them as quickly as you have, but they are simple fixes in one respect. We made a change to our healthcare plan at the first of the year. We got a tremendous increase in premiums that was coming at us, so we decided that we were going to change carriers. Lo and behold, making that change made a huge impact for my staff on some of their mental health services. I had no clue. Some of my staff were putting out their own personal dollars to amounts that just absolutely are staggering to me. So we're looking into that one. I realize that the staff is not taking advantage of the support programs that we've been putting into place, so we have to look at that too, because they're going outside. They feel they need additional supports. They need more. The other thing we found out was that we put a policy in place about 18 months ago, where everybody now is wearing branded uniforms. So they're wearing scrubs and tops and all of that. Oh my. Well, they look great, but they don't fit everybody exactly the way that staff would like them to fit. So we found out that they were very unhappy with them, that they'd been spending a lot of money on them and still were dissatisfied, because what did we do? We told them there was a certain color and there was a certain manufacturer they had to wear. As one nurse said to me, it doesn't work. I'm small on the top and I'm bigger on the bottom, and this brand doesn't fit me. And no matter how many different styles of that brand I try, it doesn't fit me. So she's very conscious that when she leans over the bed to a patient, that she's showing more than she would like to. I said, that's a problem. So we are looking into what we're doing with scrubs and trying to change some of those things, little things. One nurse said she could have a yard sale with all the uniforms she had. Just broke my heart, just broke my heart. And then the last thing we found out was that the engagement tool that we were using to get feedback from the staff, it's not working very well. It's actually turning into being more of a divider than trying to be more inclusive. So we're also looking at that, because it is an online tool and people have started to use it more like the Facebook pages. And sometimes we have to step back and say, wait a minute, this is a professional environment. And the staff are saying, we don't like it because we don't like the negativity. Ultimately, they said, what are you going to do with this information? And I said, what do you want me to do with this information? And they said, well, first off, we feel very heard, but second of all, we want follow-up. So I really thank the folks that were a part of our session. It was a small group. The second thing they said was, we think you should do this across the organization in all the offices with different groups of the staff. So we will definitely be doing that. One of the things I learned out of this, which was interesting, which I'm embarrassed to even say it, but I did not think about my own leadership team and their reactions when we were doing this session. It was late afternoon. I think we went 3 to 4, 3:30 to 4:30, something like that. I walked out of my office and saw one of the members of my leadership team, and this person was white. I looked over, I said, are you okay? Yes, I'm fine. Can you tell me what happened in there? Is everything okay? Worried. worried about the feedback. So I was very specific the next day to talk to my leadership team and for them to know exactly what went on and to tell them how non-threatening the feedback was and really how constructive it was. Now they want to do them. Now they're trying to figure out how we go from a town hall, funny that we're sitting here having a town hall. We do quarterly town halls, but there's a running their course too. So now they want to go more toward listening sessions in between town halls. But how do we do that when we have 99 million meetings? So it's led to another discussion about how we use our time. All great stuff. I am going to do it again. I look forward to doing it again. And I need to say, one of the things that I have been striving for in our organization for a long time, because we're in a very competitive environment, is I know they love their work. I know they love their patients and families that they're serving. I know that they love their colleagues. But some bit of loving on their organization that works so hard to care for them, I heard major kudos back from the staff about just how much they really like working at our organization. That was heartwarming and something that I could share with leadership, who also works very hard for them.
Susan, thank you so much. When I think about the pieces of feedback that came back from Brian and Susan when they did the download to me, there was a couple of things where we never really anticipated, or there's nothing in the toolkit in the beginning about how do you communicate about these in the beginning. Brian, you had a special way of communicating with your people about it in terms of you didn't put up a big poster and say, now hear this, we're doing a listening session. Can you talk a little bit about what you did?
Well, what we did is we actually went to, I had Jennifer, our hospice director, talk to the staff, and she selected, and we said, you've been chosen to be part of this unique pilot program with NHPCO, and we just want to hear some input and feedback from you all. So I think they walked into the room thinking that they were, special. They had been chosen to be innovators in their own right. And I think that broke some ice to know that, and I think that's a good point that Susan made. You don't want people to think they're meeting with the CEO, is something bad going on? It was definitely designed to be something to really hear from people. And the good news, I don't know, in your organization, I'm pretty confident that that group took that information to other people too. Sure. It just ran like wildfire. People were telling people that leadership is listening, and like Susan said too, it wasn't, people did in our organization say, I love to be an employee of this organization. It wasn't like a gripe session. I love this organization. Here's just some concerns that I have, and they were very open, very honest, very transparent about them.
Yep. I love it enough to tell you what could be done to improve it. I love it enough to be here and to take that bit of a risk to do that. And I think, Brian, the other thing that you did that I thought was particularly important was that he didn't make a big deal out of it to, like, we're having this session, there's only this group of people invited, and so if you're not invited, that's too bad for you. But he didn't overblow that session. He said he kept it on the down low, and said that you mentioned that you certainly shared it and told people you were doing. So the other thing is, it shouldn't be kept a secret, as if people can't know that we're having this listening session, because that undermines trust and people's sense of inclusion in the organization as well. But Susan, you also highlighted for me, and I had to go back and put it in the toolkit, that don't leave out your senior leaders, your leadership team, because we even shared, I think you gave me the feedback, can we share the toolkit with them before we even do the listening session, even if they're not involved? Absolutely. There's nothing secret in that toolkit. I didn't know you also gave them the questions in advance. And for some of you have done the social styles or the DISC profiles, where you've got the D, I, S, and C. You've got a couple of groups in there that really don't want to be put on the spot with an instantaneous question that they're supposed to respond to. They want time to internalize it, to think about it. How respectful is it to be able to give them those questions? I think it might also lower a feeling of risk or concern, like what are we brought in here for? First of all, are we in trouble? Is this going to be a little bit of an enticement trap? We're going to get in here and find out that we actually are in trouble, or how risky is this? To get those questions in advance, we don't have that even in the toolkit now, because that's a piece of feedback I just got, but we will put that in the draft of the toolkit. I think the other thing that I heard here was, Brian, you mentioned that you went not with the most difficult, angry, recalcitrant, ticked off group. you went with people that you knew would share some constructive feedback. We recommend, and certainly those of you that are involved in quality improvement know that when you're running a test of change, you're running an intervention, a new change to a process. You go where it's most likely to succeed, especially when you're getting your sea legs about how to run it. So want to be sure that you heard that. Do that in a safe way in the beginning. You don't have to set yourself up with the people who are likely to go ballistic on things, or you can handpick the first groups, especially as you're getting your understanding of how do these things flow, what's the role of the facilitator, and so forth. And I think those are some important points. I'm going to go ahead and show you what Mary Kay had to say as well. These are Mary Kay's slides, and she sent them to us, even though she could not make it today. I love her, and kudos to her for doing this. She said that her first try, because at first she said, sort of toolkit, schmoolkit. I think this is just I'm going to go talk to the employees, and I'm going to talk with some staff. So she did it with your employee engagement team about morale. And she said she decided she would have no facilitator or note taker, like was said in the, by the way, I want to make another point. Brian's point about, or maybe it was Susan's point about letting people know that there's no attribution. I don't know if we have that strong in the toolkit, but if we don't, Carrie, I know you're listening. I got to make a point of making sure that we say, be sure that you let people know that we will be talking about themes in terms of note-taking, not about attribution to individuals. So you will not have this tattooed on your forehead once you leave out of here that we know you said this or that. She had no facilitator or no note taker, and she said that she just kept jumping in. Brian said, I just had to be quiet. Well, she said, I couldn't resist. I just couldn't be quiet. She said, so I got in there and I was sort of defending and explaining and talking about this, and she said, and obviously it was anything but a listening session at that point. She said that she just could really feel, in a sense, that it took some of the energy away, because here it was very different than what the intent of this was. She said that the post-session follow-up, she sent a follow-up email to the teams about the items that they discussed, and she said that she would also share it as a staff meeting, but she said, I knew I had to do it again. And she said, and this time I had to do what it said to do in the toolkit. And so she said her second try then was, the topic was about ER and hospitalizations of their hospice patients, which really the staff was starting to feel some concern about, what are we doing wrong? Why are our patients ending up in the hospital? And she said she used an outside facilitator this time, one that fit the profile that's described in the guide. This one was Zoom. She's had a cameras on requirement. She asked, if you're going to participate, we really please need to see your face if you're going to do so. I would also mention that in our fall session, we did not have everybody on camera. It still worked, but I'm guessing in your own staff situations where you have smaller groups, they're more cohesive. I like the idea of let's see people's faces if you have to do it virtually. She said she was the note taker this time. She said, which also kept me busy and less likely to intervene and intrude in the session. And she said she included admin nurses, social workers, and RN case managers. 2 leadership team members were present there to listen and learn, but these are her words. All of these are her words, but I controlled the mute button. And she said, and I found out I had to. She said, but there's just something about us listening and learning to listen without interruption to our staff that somehow didn't come naturally to us. So on her second try, there we go. She said she asked these 3 questions. Is there really a problem? Patients are being admitted to the ER and so forth. They discussed that. What's the impact on the organization? And if there is a problem and there's an impact, what should we do about it? She said that they really took use of the hand-raising function so that people could speak one at a time and they weren't talking over each other. By the way, Brian's session was in person, Susan's was virtual, so this has been tested over both of those ranges of approaches. She said that she was just surprised and delighted at the interdisciplinary interaction. She said there's always a friction between her clinical staff and their admissions staff, and they were complimenting each other and asking about how something gets done, or saying, gee, I didn't know that, I learned that, and what their roles were. So there was a tremendous amount of learning and exchange going on among the 2 of them. And then the RNs and the MSWs acknowledged each other in such a positive way. And she said great solutions and suggestions came out of it. So she said, I was just so surprised at how many solutions. I know this can feel, I know the first time I ever ran it in my organization as a CEO, I just sure they were going to say double staff by next week. they were going to have these suggestions that I can't do these things, can't do it. And not that they didn't have some recommendations for some big changes in the organization, but I was also surprised about one of the things. We had grown so fast that we needed a second refrigerator in the break room, because the refrigerator was constantly, you'd open the door, things would fall out, splat on the floor, and it was just not something that we'd thought about. We needed the second microwave as well, because people were jammed up in there. I cannot tell you how much staff emails and thank yous and things I got from a refrigerator and a microwave, which was really a relatively inexpensive outcome of that meeting. So not everything, it was just like the scrubs, where you find out you kind of got some things going on going, are we really doing that? And there are some of these things that when you become aware of them, you immediately want to make a change. So Mary Kay also said that her lessons learned were, she said that she did not realize what a key leadership competency that listening is for her leadership. She said, I don't think we're as skilled in this as we need to be. She said, I'm going to now include this as part of my competency for leaders. She said the method allowed for staff input because she said they usually know the answer. We just don't create the conditions in which they can bring the answer to the surface. When they can bring it into a situation where we can all hear it, we can build on it, there's energy, there's synergy. And then we achieve buy-in for working on this issue together. She said that make sure you communicate back to staff about the follow-up on this. That is essential, is that people will come out of these things, they come out inspired. You've really spoken to their soul a little bit. They feel engaged. They feel a sense that they're going to have an impact and a change on this. And it's very easy for them to walk back into their work environment and kind of burn up on reentry, where you go back in and all of a sudden there's all the challenges, and then they hear that follow-up has happened. Something has come about, a change has come about. And there's that sense of deepening engagement and a deepening sense of connection to each other at a really, really human level. And that right there, we know for people who are just spent, who have just given their all psychologically, physically, professionally, they're giving their all to feel that sense of some of the deepest rewards of that. It went into this for those kinds of feelings of connectedness and assisting people, including each other. So she said that the process provided support to the team members and recognition that they gave to each other, she said was absolutely invaluable. So what we want to do is issue an invitation to you to use this toolkit that we've co-developed here. And I want to offer up any more points that Mary Kay, or that you and Susan, you and Brian want to make, and then I'll add one more thing from Mary Kay. But as you're thinking, what else came to mind?
Well, one thing I want to mention too, right after the session, one of the participants who's a nurse, she emailed me and she said, I used to work at the hospital, and she said they would do things like this at the hospital to check a box, but it never felt like anything ever changed as a result of these. And so she said this was one we actually had, and actually I felt like someone was listening to us, and things actually, changed as a result of the meeting. And so, and I think we've all been in organizations where it's like a required thing, we meet with the staff and we listen, but nothing ever happens. And they felt like, as was mentioned, the follow-up is so critical and so important.
I think the follow-up is going to be a huge part of the building the trust moving forward with this small team, but I look forward to broadening it to see what else I hear from our staff. I think they were brave, and I feel like I owe them a great, I have a lot of gratitude about them being able to come in and really talk about what was going on for them and opening up to me, feeling safe enough to say some of the things that they did, because the first part of it, I have to be honest, we did find these, I'm going to say they're little things because I think they can be fixed relatively quickly, but the bigger things about how they're feeling right now and what's coming out of that for me and the leadership team to support them more as we go forward, I think is critically important to our retention. And I just came out of a session where, oh my gosh, I forget what the number was, I wrote it down, but extraordinary cost to have turnover in the organization, and our rates have gone up since COVID came on. So I'm very focused on holding on to the great hospice people that we have. And I think this is a great tool to get there.
Well, I don't know if we have it set up for you to be able to ask questions, but I think we do. Are there microphones? And if you have any questions for any of us, well, we would be happy to respond to your questions. And while you make your way to the microphone, if there are anybody with questions, I'll add a couple of more pieces to this. I do think that a couple of things, Brian mentioned that he said in the very beginning, I can't make promises that everything I hear I can respond to and solve. There's an authenticity with that as well. They know that. They at one level know that if you could snap your fingers and all these problems would go away, there would be enough staff, there would be no turnover, there'd be no COVID, there'd be no isolation, there'd be none of these issues that are really taxing our organizations right now. You'd do it already. And so I think that there's nothing wrong with saying that. It's all in how you say it, because you've got to be careful that it's delivered in, I'm here, I really want to listen. They have that understanding, and sometimes it's just an emanation from you that when you really mean that, they know it. Versus saying, now, don't be telling me that you want this, that, or that sort of thing is right away. You're not here to listen. So there is a way to say it. Brian, can you say exactly what you said on that?
Well, I mean, I made clear, we wanted to hear what they had to say. I think it was more towards the end of the session. I said, we're going to listen to everything. We've taken notes. We're going to meet. We're going to review these. And I can't promise that I can, do everything that you've brought up in this, but we'll certainly look at everything, and I will get back to you. And if it's something we can't do that you brought up, I'll get back with you on that. I think I even mentioned, as you know, we have budgetary restraints, but really, like Susan said, most of the things that they mentioned are things that can be easily kind of tweaked. And a lot of times we think our employees, if they get the opportunity, they just want to gripe, sometimes. And really, it's like Maslow's hierarchy of needs, you know what I mean? It's just these basic needs that people have, and one of those is to be heard. And if they know that leadership is actually listening to them and can make those changes, the morale and how it impacts the organization is huge.
And I'm surprised at when you're not able to do something, when you have the courage to come back and say, we looked into this is how much this would cost, or this is what, we're trying to balance that against this and that. They really can process that information quite well. It's when it's a feeling like it's in a cone of silence, or you're not trusting them with information around what underlies decisions, that they feel that there's a chasm between leadership and staff, that we're not in this together. They don't trust us with the knowledge and information. So I always found that when I was doing this with my staff, if I couldn't do something, I would at least come back and talk about that. And if I couldn't do that exact thing, then let's figure out what else we can do, or maybe we work toward that, and it's not right now, but let's work toward that. And what are some interim steps that we can do? What can we do instead of that, but that would start to meet some of these underlying, and if you listen deeply enough, you can hear the things that the needs come out loud and clear, and then it becomes, for that, then out of that, you start to develop very creative solutions. And I mentioned that all of us are better than any one of us. And that feeling too, that people support what they help create. So if they're a part of that, and then they hear that something came out of that, and you engage them again and again in that solution creation, it's quite remarkable. Yes?
I can't tell. Yep, is it on? Okay.
Yeah.
Hi, my name is Melinda Gruber. I think you did a great presentation. I'm really excited about the toolkit, so thank you very much. My question is around the comments about listening to things team members were saying, and knowing that maybe there was, or at least this is how I interpreted it, knowing that they were maybe had a wrong assumption, or just you wanted to respond and correct. I just wonder how you either circled back to eventually give them the right information, or did you literally not, and how did you eventually educate them?
That's a great question. I think I was thinking about this too, because you sit there and like, I know we're doing all this staff support. I know we've been doing. I know we've done it. Stop. Just stop. Listen to what they're telling you. Go back and find out what the situation is. I thought it was very important not at that moment to do any yeah buts. I just felt like I needed to listen. I didn't need, even though I was cringing inside about some of the things, it was like, nope, this is not the time. And if this has been going on for, I don't know how long, if it's been going on for a couple months, it can wait for me to think this through and get back with them with a thoughtful follow-up as opposed to just firing off. Because I think, my experience, if I fire off, I'm usually wrong.
And I think my group a couple times had what they perceived as solutions, and I knew behind the scenes that those solutions were just not feasible. But I didn't want to rain on their parade and say, you know, we've already looked at that, and there's a reason why we couldn't do that. Now there was, and I didn't mention this when we had our preliminary talk, but there was one situation that took place in our session that I felt like I needed to speak up. It was the only time I did. We had a chaplain who spoke up and said that once upon a time, or he felt like he was expected to come in to see somebody at the hospice house I think on a weekend as a courtesy and do that and not get paid. And so I said, well, the DOL requires us to pay you when you come in and work. So I just want to be clear on that. And so that was one thing that I, kind of went off script because I felt like that was something very important that I didn't want that to be missed. He worked, he needed to be paid, and I told him that should never happen again, and if it does, to let me know. But the other comments that were made were just solutions that in some ways were simple solutions. They sounded simple, but I knew there was like a big dollar amount attached to them, or they weren't really practical. But I didn't say all that. I just bit my tongue and I just listened, and it was good too, because if you didn't say anything, if I had said something, it would have stopped all that conversation.
Yeah.
And so I didn't say anything, and so then it didn't really stay there. It kind of moved somewhere else and went in another direction. So it seemed to work out well.
So one of the things that keeps it from being a gripe session is if they don't feel like you're opposing, if they start to feel like they're oppositional. And in this case, Brian stepping in and saying, he was actually correcting a really serious misconception for the positive. He wasn't rebutting, defending, denying, none of those things. He was making sure that people understood we comply with the law. And if you ever thought you've been asked to come into work, that's not what we do here. But I'm very pleased there was only one time there was that intervention. And so I think too that the great thing is that you can at least learn what the misconceptions are. And then in another setting, in another venue, bring information back about something, help them understand why something is something, because they clearly don't. I was so surprised because I thought I constantly communicated clearly to my staff. And there were misconceptions galore but I wouldn't have known about them otherwise, and I had no opportunity to correct what I didn't know about. So that's the other thing that made it so valuable to me. So we'll just close this session by thanking you for being here. What I want to say just in closing for all of this, thanking Brian and Susan and Mary Kay for their intrepidness and their willing to be the first on this, and for NHPCO for allowing me to participate in something that I have found incredibly inspirational and growth-inducing for me and everyone who's come in contact with this, that together we're the ones we've been waiting for. Especially as we bring our staff into all of that, we're the ones that we've been waiting for. We've got the ideas, we've got the drive, we've got the commitment, and we've got each other. Thank you so much for your time and attention today. Really appreciate it.
Thank you so much, Laura, Brian, and Susan, for sharing your insights and experience. And we hope this conversation will continue at our respective provider sites and amongst us here. We sincerely appreciate all the insights that were shared, the conversation today. We hope that you will use the toolkit at your own sites. Also, that we are going to continue this and find ways to integrate this into some of the other NHPCO activities, perhaps through our My NHPCO communities, and helping those be venues for further exploring application of this toolkit and sharing and learning from each other's experiences in using it. So now's the time to get out your smartphone or tablet and complete the assessment and session evaluation for us so that we can learn from that as well and give us your feedback on that. To do so, select the rate button on the sessions page. And please take this time also to write down one or two key takeaways or action items that you discovered in your notes section of the app. So hopefully by the end of this conference, you will have a nice list to take home of takeaways. So again, thank you for your time, attention, and being here with us.